In the traditional medical model, the so-called gold standard for diagnosing chronic pain is usually an MRI. Based on the findings of the scan, a majority of doctors decide the treatment process. Many providers only treat based on what is found on the MRI and completely ignore all the other contributing factors. There's also a different faction of providers that say the MRI doesn't matter at all and it doesn't tell us much of anything. In all honesty, it's somewhere in the middle, and both mentioned providers get it wrong all the time. In this video, I explain why the MRI findings do matter, but they certainly don't tell the full picture. For those of you who don't know me, my name is Dr. Maggio, and I am a chronic neck, shoulder, and back pain treatment expert with over 15 years of experience. My process focuses on finding and releasing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain without the use of medications or injections. So what is an MRI good for? It's really good at showing us if there's damage to structures, like the bone, the cartilage, the disc, the tendons. What it doesn't do very well is tell us what the surrounding soft tissue looks like, especially the fascia, the muscles, and the nerves getting stuck and loaded up with this glue-like stuff called adhesion, also known as scar tissue. Think of the damaged structures that show up on an MRI as your thumb and it's stuck inside a car door. The car door is all the adhesion around there, and you can't give the thumb a chance to heal up until you remove the car door. So yes, the damage in the structures that show up on the MRI are contributing to the pain, but essentially they're just the effect, and the true cause is the bad tissue all around there. The treatment process really needs to account for all the factors, not just the ones the providers get to pick and choose. And the focus should always be on first treating the root cause of the problem to take the pressure off the damaged structures. Then, and only if there's still a lot of pain, get the damaged structures addressed by a surgeon. Unfortunately, this is completely backwards in the traditional medical model, and it's no wonder that chronic pain still runs rampant in our society. So if you're tired of the runaround by the medical system and you just want some real answers, then click the link in our profile to request a no-charge consultation and finally get some honesty as to what is going on and on the path to feeling and functioning a heck of a lot better.